Before starting Uptravi 1800 micrograms intravenous solution, make sure to read the Patient Information Leaflet from your pharmacist. This medication is given by injection into a vein by a healthcare professional, usually twice daily and infused over 80 minutes. The dosage is based on your medical condition and other medications you may be taking. Your doctor may direct you to start at a low dose and gradually increase it to reduce the risk of side effects. Use this medication regularly at the same times each day to get the most benefit from it. Make sure to tell your doctor if your condition does not improve or worsens. Some common side effects of Uptravi 1800 Mcg Intravenous solution pulmonary antihypertensive agents, prostacyclin type include pain, redness, or swelling at the injection site, headache, nausea, vomiting, diarrhea, loss of appetite, flushing, jaw pain, joint or muscle pain, and pain in your arms or legs. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Selexipag, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions or other issues. It's also essential to disclose your medical history, especially if you have liver disease. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, this medication should only be used if absolutely necessary, so be sure to discuss the risks and benefits with your doctor. It is not known whether this drug passes into breast milk, so consult your doctor before breastfeeding. And as always, consult your pharmacist or physician for more information. It's important to be aware of potential drug interactions with Uptravi. Make sure to inform your doctor and pharmacist of all the medications and herbal products you are using. Do not make any changes to your medication dosage without consulting your doctor. Some medications, such as gemfibrozil, can affect how Uptravi works in your body. Always follow your doctor's recommendations for the best results. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center for assistance. Be sure to keep all your regular medical and lab appointments. This will help your healthcare provider keep track of your progress and make any necessary adjustments to your treatment plan. Be sure to take each dose of this medication as directed. If you happen to miss a dose, consult with your doctor or pharmacist immediately to determine a new dosing schedule. This medication is administered in a medical facility and should not be kept at home. It is used to treat pulmonary arterial hypertension. The recommended dosage is 1,800 micrograms per day, divided into multiple doses. It is important to follow the prescribed schedule for optimal effectiveness. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.